For those who have unusual lumps on parts of their body, such as the wrist or top of the foot, but no pain, it could be a ganglion cyst. Ganglion cysts, while often painless, can grow over time and potentially cause pain by pressing on nerves. Therefore, it is important to visit an orthopedic specialist early to receive proper treatment for this legitimate medical condition. In this video, we will thoroughly explain ganglion cysts, a disease commonly found around the wrist and top of the foot. Starting with what ganglion cysts are, we cover the causes, symptoms, diagnostic methods, and treatment options, all supervised by a practicing physician. If you think you might have this condition, or if you have heard of ganglion cysts but don't know much about them, this video will provide information on the causes and treatment methods. Please use this accurate knowledge to maintain your health. Hello, we are Medivery University Hospital. Our channel provides information about diseases and medical health according to a Japanese physician. If you are interested, please subscribe to our channel. What are ganglion cysts? A ganglion cyst is a benign soft tissue tumor that is often found in areas like the wrist and ankle joints. A soft tissue tumor refers to a tumor occurring in tissues other than bone, such as muscles, nerves, and tendons, and is a term commonly used in orthopedics. Ganglion cysts are thought to originate from the joint capsule, a membrane that encloses a joint and can develop anywhere there is a joint. Occasionally, ganglion cysts may also occur around tendons, the meniscus of the knee, or the intervertebral discs of the spine, among other soft tissues. While the cyst itself is usually painless, if it grows large or occurs in a problematic location, it can press on or stimulate nearby nerves directly or indirectly, leading to pain, numbness, or fatigue. Diagnosis of a ganglion cyst involves confirming that the tumor is not bone-related using X-ray, examining the contents of the tumor with ultrasound, and considering MRI for a thorough evaluation if there is significant concern. During these examinations, if a ganglion cyst is suspected, the diagnosis can be confirmed by aspirating the jelly-like contents of the tumor with a syringe. It is important to note that one should not simply assume it is safe to aspirate with a syringe. If it is assumed to be a ganglion cyst and aspirated, but it turns out to be cancer, the aspiration could potentially cause the cancer to spread to the skin or other organs. Ganglion cysts are observed in a wide age range, but are particularly common among people aged 20 to 50. As for treatment, while direct aspiration of the cyst with a syringe can reduce its size, this approach generally leads to recurrence. Therefore, for ganglion cysts that are painless, watching and waiting is usually acceptable. However, treatment, such as aspiration, may be necessary for those with pain or who are concerned about the appearance of the cyst. Due to the high risk of recurrence, it becomes a challenging condition where surgery may also need to be considered as necessary. Cause. The exact cause of ganglion cyst development has not yet been elucidated. However, as mentioned earlier, this condition is more commonly observed in individuals aged between 20 and 50, and it is said to occur more frequently in women. On the other hand, women in their 20s and 50s tend to be more concerned about their appearance compared to other women of other age groups and men in general, and are more likely to visit a hospital even if they are not experiencing pain. Therefore, it is possible that ganglion cysts do occur in men and women of other age groups, but these groups may just be less likely to seek medical consultation. This makes it difficult to definitively state that ganglion cysts are more common in women aged between 20 to 50. There are reports suggesting that ganglion cysts occur more frequently in people who frequently use their hands, and that overuse can lead to larger cysts. However, these are merely speculative and not backed by reliable data. While the cause of ganglion cysts development remains unclear, the mechanism of its formation is understood. It is believed that synovial fluid, produced in areas like the joint capsule and tendon sheath, leaks out and forms a thin channel, eventually swelling up like a balloon in areas of lower pressure. The synovial fluid becomes viscous due to a substance called mucin, resulting in the ganglion cyst often being a somewhat firm tumor. Symptoms and characteristics. Ganglion cysts are benign soft tissue tumors and non-cancerous, so they can be left untreated if asymptomatic. However, treatment becomes necessary when the cyst grows large, causes significant pain, compresses nerves leading to numbness, or hinders hand movement. Therefore, it is recommended to visit an orthopedic specialist immediately if these symptoms are present. Ganglion cysts also exhibit various characteristics depending on their location. Having compiled this information, for those experiencing ganglion cysts in the applicable areas, please refer to it. Mucus cysts. A mucus cyst is a condition similar to a ganglion cyst, occurring on the back of the hand at the first joint of the fingers, slightly below the nail base. Mucus cysts start off small, about the size of a matchstick head, and gradually increase in size. The skin in this area is thin, so the jelly-like substance inside the cyst can often be seen through the skin, commonly described by patients as a water blister. These cysts can rupture when bumped, releasing the jelly-like substance. Individuals with mucus cysts frequently exhibit deformities in the first joint of the finger, known as the DIP joint. The osteoarthritis of this DIP joint is referred to as Heberden's nose. Because mucus cysts, even if punctured by aspiration or if their contents are released through spontaneous rupture, not only tend to recur but also carry significant risks of infection and skin defect, surgical intervention may be necessary. Dorsal wrist ganglion cyst. The dorsal wrist ganglion cyst is the most commonly occurring type. It often starts as a small, painless tumor that only becomes a concern as it enlarges, leading to an orthopedic consultation. Dorsal wrist ganglion cysts are almost diagnosable based on their location and the elastic feel upon palpating. However, as mentioned earlier, mistaking it for just a ganglion cyst could be risky, as there are rare instances where it turns out to be a cancer. Therefore, undergoing a thorough examination is advised. Palmar wrist ganglion cysts. Ganglion cysts frequently occur on the palmar side of the wrist. They are most commonly found on the thumb side, followed by the little finger side. Ganglion cysts on the thumb side often develop near arteries and nerves, leading to compression and pain. Care must be taken when treating ganglion cysts on the thumb side, as there is a risk of damaging the nearby arteries and nerves. Intratendinous and tenosynovial ganglion cysts. Ganglion cysts can also develop within the tendon sheath or the tendon itself. The tendon sheath functions like a tunnel for the tendon, allowing it to transmit force efficiently. You might be familiar with the term tendinitis. These intratendinous and tenosynovial ganglion cysts typically form on the palmar side at the base of the fingers or near the second joint. They often appear as small, sesame seed-sized, somewhat firm cysts, which can compress nerves or other structures, causing pain. These ganglion cysts can also restrict finger movement. In rare cases, they may be mistakenly diagnosed as tendinitis, and only after surgical opening of the tendon sheath, it is found that the underlying cause is a ganglion cyst within the tendon. Occult ganglion cysts. An occult ganglion cyst is a type of ganglion cysts that cannot be detected from the body's surface. Unlike ganglion cysts that form noticeable bumps on areas like the ankle, occult ganglions develop deeper within the body and are not easily self-detectable. For instance, these ganglion cysts may not grow large enough to be visible on the back of the hand, but can cause persistent hand pain or finger numbness, leading to their discovery during an orthopedic consultation and subsequent testing. Such ganglion cysts can be the cause of conditions like carpal tunnel syndrome, ulnar nerve palsy, and posterior interosseous nerve paralysis, motor paralysis of the radial nerve. While it is possible to suspect an occult ganglion cyst through inquiry and palpation alone, however, it is crucial to perform MRI scan or ultrasound examinations to confirm the diagnosis. If possible, aspirating the jelly-like substance with a syringe can both confirm the diagnosis and serve as treatment. Diagnosis of ganglion cyst. The diagnosis of ganglion cysts seems easy but is actually difficult. Initially, a medical history is taken to ascertain if the lump appears to be a ganglion cyst, focusing on the location of the lump when it first appeared, its size, and any symptoms such as pain or numbness. In this clinical assessment, a provisional diagnosis of a ganglion cyst can be considered, but it cannot be confirmed without examining the inside. There are numerous cases where a lump that appeared to be a ganglion cyst turned out to be a different tumor, and the worst cases are those where it was a cancer. There have been instances where a lump thought to be a ganglion cyst was aspirated with a syringe, only to discover later that it was a cancer that subsequently metastasized. However, nowadays, clinics can perform ultrasound examinations, which can determine whether the lump is a frightening cancer or something that resembles a ganglion cyst filled with mucus. And only after it is understood that something like a ganglion cyst filled with mucus and the like has accumulated, is it possible to have it punctured with a syringe, aspirate the jelly-like contents, and finally confirm it as a ganglion cyst after examining this. Treatment. Ganglion cysts are treated when symptoms are present, such as when the cyst grows large, pain is significant, the cyst compresses nerves causing pain or paralysis, or movement of the joint is impaired. In the treatment of ganglion cysts, there is a method called aspiration, which involves using a needle to puncture the cyst and withdraw the jelly-like fluid inside. This procedure aims to reduce the size of the cyst and alleviate associated symptoms such as pain or discomfort. However, in cases of recurrent ganglion cyst, infection caused by needles or other factors, or when the ganglion cyst is located near nerves or blood vessels, surgical removal of the cyst under proper anesthesia may be necessary. Therefore, it is important to choose the appropriate treatment method based on the patient's condition. It is important to note that ganglion cysts are difficult to cure fundamentally. Even after aspiration or surgical removal of the cyst, there is still a possibility of recurrence. Ganglion cysts are known for their troublesome nature of recurring after treatment. Prevention. As previously mentioned, since the exact cause of ganglion cysts is not known, prevention is considered quite difficult. Ganglion cysts are benign and not necessarily dangerous. However, they are troublesome due to their high likelihood of recurrence. Therefore, if you experience any pain or discomfort, it is advisable to consult an orthopedic specialist early for examination and potential treatment of a ganglion cyst. If you notice a prominent lump on the wrist or top of the foot, or anywhere on the body's surface, consider consulting an orthopedic specialist. Moreover, this applies not only to ganglion cysts, but to all soft tissue tumors. They cannot be diagnosed solely based on appearance. Even when a ganglion cyst is almost certain based on the patient's account, I always perform an ultrasound examination to verify the contents. Relying on experience or intuition and aspirating without verifying could lead to irreparable consequences if the tumor turns out to be cancer. While some may say this approach is overly cautious, I believe that tumors require such careful consideration. How was the video? We want to know what you would like to see made into a video. If you have any health questions or unexplained symptoms that you're concerned about, please let us know in the comments section. If you found this video informative and interesting, please like and subscribe to encourage us in our future activities. Thank you for watching.